Hello, my name is Haley Davenport. I've been a project manager with Critical Path Institute since 2021. I'm a biomedical engineer by training, and I've spent my career working in medical research. But today I am very excited to be able to share my personal experience as the patient. I've lived with type 1 diabetes since 2008. So I'll be sharing my story and outlining what I see are remaining unmet needs in the new-onset type 1 diabetes space. So jumping right in, I can share my type 1 diabetes story. I was 14 years old when I was diagnosed with type 1 diabetes. I do feel very fortunate to have experienced 14 years of life as a healthy child. I was a freshman in high school. I had been a dancer from a young age. I was a cross-country runner, as shown in the slide, somehow long-distance running in the summer Arizona heat. But these pictures were taken only about 3 months before my diagnosis. At this time, I had no significant medical history, and my biggest medical concern had been getting my braces off before starting my freshman year of high school and just fitting in like a normal teenager. I had no family history of type 1 diabetes, nor had I ever met anyone who had it. So basically, I was a healthy 14-year-old until I wasn't. My diagnosis came on December 30th, 2008. It was the winter break of my freshman year of high school, and I suddenly became really sick. I was experiencing extreme fatigue, rapid weight loss, frequent urination, extreme thirst, nausea, and throwing up, but it felt like maybe I just had a really bad flu. So when heading to the pediatrician's office, thinking I had the flu, we had no idea that I'd almost immediately be diagnosed with type 1 diabetes and hospitalized, as seen in this photo. I was actively experiencing diabetic ketoacidosis, and my HbA1c was 13% at the time. I was immediately put on insulin therapy, and I learned that if I hadn't been hospitalized when I had been, I could have entered into a coma, or worse, I could have died. So once I was hospitalized and beginning to really understand what all of this meant, I learned that I didn't really have any treatment options because the only option available was to inject myself with insulin for the rest of my life or I would die. So suddenly I found myself bearing the eternal responsibility of acting as my own pancreas. I was no longer a carefree child who was healthy. This sudden and drastic change to my life was a heavy weight for my family and me, although I do feel very fortunate to have had a supportive family system. The doctors told me I could still live a long, healthy life. I could still feel normal. I could still do all the normal things of a teenager, but I would have to learn to think like my pancreas at all hours of the day. So I learned how to survive with type 1 diabetes. Although insulin pumps were available at the time, I began my T1D journey with continuous insulin shots, which turned out to be quite complex. All of a sudden, there were carb ratios and correction factors. I'd learned I'd have to prick my finger to test my blood glucose 6 to 10 times a day and overnight, and that I could never eat anything again without first counting the carbohydrates and administering an insulin shot. And ideally, this would have to be 15 minutes before eating the first bite. I had to give myself one giant shot of long-acting insulin once a day and continuous short-acting shots throughout the day, so sometimes up to 10 shots a day or even more. It was all a lot to learn, while also grieving the loss of my health and coping with the idea that I would have to do this for the rest of my life. And how does one think like a pancreas? What does that even mean? And it turns out thinking like a pancreas was pretty complicated. To me, T1D feels unique in that the medicine that's keeping me alive can also easily put me in grave danger pretty quickly. Too much insulin is dangerous, too little insulin is dangerous, and the amount of insulin that I need changes hour to hour and is affected by so many different factors. Low blood sugars can only be treated with sugar, yet sugar can also raise my blood sugar too much, requiring more insulin, which can cause another low blood sugar. So it can become this seemingly endless cycle, and it was all so complicated. Here I've outlined my most notable symptoms of the highs and the lows. Again, too much insulin means a low blood sugar, and for me, that just stops me in my tracks. I become dizzy, shaky, brain fog. My brain just kind of stops working. My heart rate increases a lot. And there's just this immediate fear that if I don't take care of this immediately, it can become life-threatening. For too little insulin, high blood glucose, I always say this feels like every cell of my body is screaming. I feel nausea, a headache, blurry vision, again, brain fog. My brain just doesn't work properly, as well as the fear of the increased likelihood of future complications with high blood sugar, kidney damage, neuropathy, retinopathy, or even just a reduced life expectancy. It would be very hard to not feel irritable and exhausted just all of the time. Things did improve slightly when I was able to be put on an insulin pump after about a year of continuous shots. This allowed for a lot more flexibility. I no longer needed to do manual calculations. I no longer needed to give myself continuous shots. Rather, I just needed to change out my infusion site every 3 days. I no longer needed to take long-acting insulin since my insulin pump was now constantly pumping insulin into my subcutaneous tissue at every second of the day. At this time, I also started using a continuous glucose monitor, although there were consistent issues with the technology, so I did not wear it all the time. Specifically, issues with CGM, they were just not accurate. They would often be 50 to 100 milligrams per deciliter off of what a finger stick glucometer reading would be. So they definitely could not be used on their own. And I was still needing to prick my finger for my blood glucose 6 to 10 times a day. In addition, at the time, sensors were just painful. It was a harpoon-like device that you'd use to put it in at a 45-degree angle. There were also issues with the pump that I still have to this day, issues with the infusion site getting infected, issues with the cannula under the skin being bent, issues with the tubing getting kinked, as well as this need to manually adjust my basal insulin rates throughout the day, which made things very complicated. In addition, the insulin pump is bulky. The one I have has tubing. It's a nuisance. It'll get caught on doorknobs and rip it out. At the time, it was definitely not waterproof or even water resistant, which made swimming very difficult. Even now, I cannot be disconnected from my insulin pump for more than about 10 to 15 minutes. My pump is also powered by a AA battery, which will indeed die at the most inopportune time. I lovingly call my pump my anchor. It's 2 feet of tubing connected to what does look like a pager. Although it does keep me alive from minute to minute, and I rely 100% on my insulin pump. Despite these incredible advances in the technology, the treatment was still only a Band-Aid, and glycemic control was still an ongoing issue at this time. I was often experiencing very severe low blood sugar events, as well as very severe high blood sugar events, without really being able to hit that range in between. So even with devices, treating T1D with insulin felt and still feels like trying to hit a moving target. In addition to the pitfalls with the devices, when you're a type 1 diabetic, my blood sugar is impacted by so many different things. My blood glucose will fluctuate a lot during the day. The amount of insulin that I need changes from hour to hour. My insulin resistance changes very frequently. Exercise becomes very challenging because although it is very good for us to exercise, it both lowers and spikes blood sugar, so requires very careful planning and becomes kind of stressful in itself. In addition, I think T1D, many know, it's not just about food. So many different things can affect my blood sugar: stress, hormones, caffeine, a cold, my insulin getting hot from the Arizona heat in the summer. All of these are just a few things that significantly impact my blood glucose. So in addition to the physical effects of the disease, the emotional burden as a teenager was pretty significant. I've always worn my devices proudly, which often would and still does invoke surprising comments from strangers. I think T1D is often misunderstood with a misconception that it maybe is related to an unhealthy diet or lifestyle, or that it's not that challenging to treat. As you can see here, these are unfortunately all real things that I've heard quite a bit over the last 16 years, most notably that you don't look like a diabetic. You just take insulin. What's the big deal? Why are you using a pager? You must have been an overweight child. So understandably, it became isolating at times to feel I had a disease that was not only misunderstood, but seemed to have some level of stigma surrounding it. So the psychological burden of the disease can feel like a never-ending cycle. Diabetes never takes a break. It demands constant attention. And even when you have devices, access to healthcare, a support system, even when you're doing everything right, feelings of burnout, I think, are super common. All of this is so much to endure, and also to know that you'll never get a break from it. It feels like even if you have a great day of blood sugars, it could be a bad one tomorrow, and that becomes a bit disheartening. A lot of shame happens relating to poor glycemic control. Personally, when my hemoglobin A1C is not where I want it to be, it feels like I've been given a grade and that I've failed. This can cause a lack of incentive to strive to improve, to remain hopeful. If I'm trying my best to achieve healthy glycemic control, but it feels like I'm completely powerless over my own body. This all drives feelings of loneliness, especially when I was 14. None of my peers lived with chronic illness, and it felt like I had this disease that had become my entire world, but it was so misunderstood by adults and my peers alike. A fear of future complications is huge. This question of what will the future hold for me? How can I plan for a future when it seems so dark and cloudy, when I'm hearing things about kidney disease, neuropathy, retinopathy, to just name a few. Fear of lows is something that I consistently feel. Lows will stop you in your tracks. So there's anxiety about having one during an exam, during an important meeting, during a presentation, during a completely inopportune time, as well as feeling low in itself is just so uncomfortable. And then all of these things just lead to an inability to sleep through the night. Specifically, there's a lot of fear of having a low blood sugar overnight and not waking up in the morning. Even with devices, there's fear about my CGM. What if it does an alarm? What if I don't wake up to it? So all of these make it very difficult. Although I was navigating all these challenges as a newly diagnosed diabetic, things did improve greatly once I began continuous insulin therapy. My hemoglobin A1C went from 13% down to 6% in just a few months. I was experiencing a partial remission phase post-diagnosis, referred to as the honeymoon period. My doctors believed I was in this honeymoon period for up to a year after diagnosis. However, it may have been longer. Glycemic control became noticeably harder around 4 years after diagnosis, and the loss of this residual insulin production led to more difficult glycemic control, especially in college. It did feel like a sudden and drastic shift. However, here was a picture of me at 16, 2 years after diagnosis, and maybe because of this partial remission phase, I was able to experience more of feeling like a normal teenager than I would have. So achieving optimal glycemic control became significantly harder around 4 years after diagnosis when I was about 18. It's been very difficult to break learned patterns from my younger years that became ingrained in how I manage my blood sugar. Some very severe hypoglycemic events happening in my teenagers led to inadvertently running higher blood sugars to avoid going low. There's periods in life where T1D is on autopilot or the back burner. It's not because it's always there and it's always affecting you, but there's times where you just can't think like a pancreas when life is being life. But because of these times where my blood sugar has run higher during periods of my life, I did have early signs of diabetic retinopathy in 2022 when I was only in my late 20s. Unfortunately, this is not something that can be reversed, and we worry about it becoming progressively worse over time. So in the 16 years since my diagnosis, there have been life-changing improvements. Faster acting insulin, accessibility of insulin pumps, having more options of insulin pumps, having accurate and reliable CGMs where I can trust what it tells me. Having a semi-closed loop insulin delivery system has been incredibly helpful. It adjusts my insulin rates in real time based on my blood sugar. And this has almost eliminated severe lows and severe highs, making them pretty rare. So also the need to check my blood glucose via finger stick almost became obsolete now that we have reliable CGMs. And most notably, something really exciting is the option of disease-modifying therapies, since these were definitely not an option back in 2008. So even with these changes since my diagnosis, the advancements have only been incremental, and T1D is still a huge burden on my day-to-day life. Poor glycemic control, the psychological burden, the acute complications of having a low blood sugar, as well as the long-term complications that I've experienced with already diabetic retinopathy, and only knowing that more things will come in the future. I find it interesting to think about how disease-modifying therapies could have helped if they were available at the time of my diagnosis. In 2008, T1D was actually not presented as an autoimmune disease, and no disease-modifying therapies were available. I think of how extending the honeymoon period for me when I was 14 would have created more peace of mind for my family. I would have been able to focus on being a teenager rather than surviving a chronic illness that none of my peers seemed to understand. It could have reduced the long-term complications. If I was older, maybe I wouldn't have developed the underlying fear of hypoglycemia that's been so hard to break even as an adult. I feel so lucky to have lived 14 years of a healthy life, but unfortunately, I've met many diabetics, type 1, who were diagnosed as a baby or a very young child, and I think of how devastating that would be for the parents. Think how wonderful the idea is that a young person with T1D could get the opportunity to have any healthy years of their life without the burden of type 1 diabetes. It's so hard to treat and it's so complex. So looking forward, it's incredible to experience firsthand the improvements that can be made in therapies for type 1 diabetes over the last 16 years. But these improvements have only been incremental, and we need to do better for future generations. Current treatment is just a Band-Aid with poor adhesive, and we need to do better. Any additional years to live without type 1 diabetes, no matter how few, would be priceless. And I feel so hopeful that disease-modifying therapies for T1D will significantly improve the lives of future generations, and how the next 16 years will even be better. I'd like to thank everyone for listening to my talk today. It's been very rewarding to be able to share my experience as the patient, and I look forward to the advances that we can make together in the T1D field.